My name is Dr. Konstantina Giesberg, and I'm a doctor of dental surgery. I'm also a diplomat of American Dental Board of Anesthesiology. Usually, anesthesia is associated with hospitals and surgical procedures. What mobile dental anesthesia is providing the same highest hospital anesthesia care, techniques, medications, but from remote settings. And remote settings can be your local dental office, it can be dental surgical center. We can bring our equipment to any dental setting. We can bring it to your dental office, we can set it up, and we can go from there and provide the same quality, the same safety anesthesia as you'll be in a hospital. My anesthesia life involves a hectic schedule. And I love it. I have passion for that and I enjoy every second of it. When I have a patient, I check the schedule and I contact the patient a week in advance. After that, on the surgical day, I wake up usually very early, 4 o'clock or so. I set up my equipment, I set up everything appropriate for the particular patients of the day, and I drive to this office that I'm supposed to see these patients. I set up my equipment in the office, I go over medical histories, I check my paperwork. After that, I see the patient, I review the medical history one more time. Then I see the patient, or the dental assistant helps me with making the patient feel comfortable on the dental chair. Then I place the monitors. All the monitors are required by the American Society of Anesthesiologists. Then I place the IV catheter. I make sure that the patient is already calm. Once I place the IV catheter, I proceed with the medications. From this point on, it takes 10 to 15 seconds for the patient to be sedated. I keep the patient sedated usually from the start to the end. I rarely lighten the anesthesia for the patients unless they have some more delicate medical history such as open heart surgeries, breathing complications, advanced age, and so on. Once the patient is sedated, I always stay with the patients. I never leave the room. Even if the surgery continues for 4 or 5 hours, I always stay with the patient. Once I bring the patient out of the sedation, I make sure that the patient recovers in proper way. I make sure that the patient is stable. All the vitals are stable. I make sure that the patient is able to speak properly, breathe properly, move properly, and is safe to go home. At Aspire Anesthesia, safety is our priority. We want to make sure that we address your needs. We want to make sure that we put your anxiety and fears at ease. And we'll be happy to work with you, to work with your dentist, dental specialist. We want to make sure that your treatment is complete, and we want to make sure that you had a great experience on the road to healthy, beautiful smile.